Good afternoon, everyone, and thank you for joining our webinar. My name is Mark Simon, and I have the privilege of serving as the new Executive Director for Nami-Wake County. And we've got a great presentation lined up for you today with a great presenter who I'll introduce in a moment. First, I just want to share a little bit about our organization. NAMI, the National Alliance of Mental Illness, is the nation's largest grassroots mental health organization. We provide advocacy, education, support, and public awareness so that all people affected by mental illness can build better lives. NAMI advocates for all who are affected by mental illness, both the individuals and the people in their lives. In particular, we work to address disparities and injustices and to promote dignity and inclusion for all people with mental health conditions. In addition to being advocates, we educate, we listen, and we lead, as evidenced by our public awareness campaigns, the range of our numerous programs we provide, and our strong public policy. For 37 years, Nami-Wake County has been at the forefront of mental health advocacy, working tirelessly to ensure that everyone has access to the support and resources they need. Our vision is simple but powerful: a diverse, equitable, and inclusive community where mental health is valued and where everyone, regardless of their challenges, can lead fulfilling lives. And now I'd like to introduce our guest speaker, Corey Hennessy. As the first non-binary executive director of the LGBT Center of Raleigh and one of the very few transgender leaders within the Triangle area nonprofits, Corey has been dedicated to creating equitable and affirming opportunities for all. In their role, Corey works alongside a diverse and passionate team to implement programs that include youth and young adult leadership skill building, education, and understanding on LGBTQ plus identities, transgender community and resource connections, health equity and access, and so much more. And with that, I'd like to hand it over to Corey.
Thank you so much, Mark. I am going to share my screen, but I am very grateful for this opportunity to come in and speak, to share a little bit of knowledge and information about the LGBTQ plus community. As most of y'all do know, it is Pride Month. And even though we are getting to the end of Pride Month, the LGBTQ plus community still exists outside of this. There's still a lot that we have to do. We got to continue talking about these things. We got to continue advocating for the community. And then I'm going to talk about a number of reasons why that matters. So a little bit about me, outside of what Mark did share. Of course, I'm the executive director at the LGBT Center of Raleigh. I've been with the center for over 7 years now, and I've been in the executive director role for about a year and a couple of months and some change. I also have gone through the nonprofit management program at Duke University. I'm a Goodman Fellow with Leadership Triangle, certified trainer with the Transgender Training Institute. And I'm originally from the Midwest, so shout out to all the Midwest folks. I much prefer it down here, but I've been here since 2011, and I really consider North Carolina my home. So I think kind of just getting right into it. I like to start with this like general large percentage, right? Large or number, specifically to give you a little bit of context and for folks to kind of really think about what this means as I go through the presentation. So 7.6%. This is only US adults that are part of the community, so everyone 18 and up. This is the most recent statistic, and over the last couple of years, it's gone up from roughly 5% to about 7.6% now. Might not necessarily seem like, a large number of people, but that is over, 20 million people. It's still millions and millions of people. So I like to say, if you think that you don't know somebody that's a part of this community, or you've never met somebody, or you never will meet somebody, there's a very good chance that you have. They just may not have disclosed it to you, or that you potentially will. Whether it's in your personal life or your work life, it's really important to know that there's a large community out there, and it's a very diverse community. There's a spectrum of people identify within, different ways that we'll go over a little bit today. So getting into terminology. So I'm going to cover just a couple of basic things. We're really going to talk about like standard kind of definitions of things. I'm going to briefly touch on pronouns, and then we'll go into some more specific data and information and how you can be more supportive. So I really like this graphic. I think it's really helpful for folks to understand where where the differences are between different parts of our identities as people. So I want you to kind of think about yourself, even if you are somebody who doesn't identify as LGBTQ plus. All of these different things, are go into how we are as humans, right? So anywhere from how your gender is perceived by others, how you identify yourself, so what, kinds of words and labels and different things that you do use, what you were essentially labeled as whenever you were born, and how you display your gender or express yourself. Oops. So specifically talking about your sex assigned at birth, or, essentially what a doctor, says, what, your community, your family, what's on your original birth certificate, what have you, right? Um, Sex assigned at birth is very much more on like the medical side. We talk about, sometimes you might hear people say, what is biological sex? What is your, sex in regards to what we think about when we're thinking about more the medical side of things, right? There's terms that are appropriate to use in specific settings like clinical or medical settings. There's also terms that we should use more in like community-based settings. So sex assigned at birth is the best, one of the best terms, or most appropriate terms to use in a community-based setting that isn't like related to any sort of medical or internal medicine. Um, the most common sex assignments are male and female. So, everybody recognizes that when you look at your birth certificate, when you look at, any legal documents, you see the M or the F, right? Most people do forget or don't realize that there's a lot of people that do identify within this intersex community, that are a part of the intersex community. There's a lot of different ways that people can show up as intersex. Some of the things that we learned in our health classes, or, anything like that, or biology classes, anatomy classes, anything like that, is that, intersex folks, that could mean that they have different makeup of, our reproductive organs or chromosomes or different things like that. But approximately 1.7% of the population are born with intersex traits. That is actually very similar to naturally redheaded people. So, it's about the same whenever you're looking out, into a crowd of people. If you see about four people with naturally redheaded hair, it's a very similar number to intersex people if you're looking out into a crowd of folks. So just kind of some interesting things to think about. And I also want to mention to you, I know that folks probably will have questions throughout, and please feel free to go ahead and put those into the chat, and we'll answer those at the end. So talking about kind of how your gender is perceived by others. So as humans, our brains are hardwired to want to categorize things. This is something that we're also taught, from the day we're born, essentially. Everything is very categorized, everything is labeled, and we really have a hard time not wanting to put things into boxes. It's been a part of like our survival tactics. It's been a part of, how we make sense of the world. And it's been a part of our, learning as we grow up. So, I like to share this because I think it's important that folks do recognize that, some of the things that I'm mentioning today, some of the things that you learn about the community, it's tough, right? If this is not your lived experience, if this is something that aren't exposed to, or you're not around all the time, it's hard to learn and hard to kind of change your thinking. So nobody expects people to get it, and understand it completely overnight. But it is important that, you do kind of work towards, some of the things to be a better advocate, a better ally, a better person towards people who do have that lived experience. So gender expression, I think, is, something that we see more often. We see, this is something that we do all the time, right? No matter how you identify. So your gender expression is how you display yourself, how you present yourself to the world, how you essentially want people to kind of see you physically. So expression does drastically change with every new generation. We see things, today that were not a thing a decade ago, or several decades ago. Um, for instance, one of my favorite examples is for women. Women, it was actually legal, a handful of decades ago for women to wear pants. So, that's something, wearing clothes, right? That's part of your expression. So that's something that was both illegal, taboo, people didn't accept that, essentially, didn't allow that to happen. So that's a part of expression that has changed over time. You see plenty of women in any setting, any given setting, wearing pants, right? You see nowadays there's a trend of men who are painting their nails. That is something that, maybe even 5 years ago wasn't really that common. That doesn't make that person a part of the LGBTQ plus community, right? Doesn't make that person transgender. It doesn't make that person anything but themselves, right? It's just a way that they express themselves, and it's the same for everybody else. So specifically talking about pronouns, and I always like to bring this up because I think that folks get really nervous around pronouns, and how to use them, what happens if you make a mistake, what, do I share my own pronouns? How do I know what somebody's pronouns are? There's, a lot of things to take into consideration, but the most important thing to remember is that everybody has pronouns. Everybody has a way that they want to be referred to as. Um, and the pronoun sets that I have up here are the most commonly used pronouns, but they're not the only pronouns that exist, right? You also think about this in context of other gendered language. Like, I get a lot of questions around, well, when do you use ma'am or sir, or, how do you address someone with respect if you don't use Mr. or Miss or Mrs.? There's a lot of things to take into consideration. And I put a resource here at the bottom. It's just pronouns.org. That is a really good place to go to just read a little bit more about pronouns, different types of pronouns. There's examples of, how to talk to someone and ask for their pronouns. There's a lot of really helpful information that, I don't have time to cover today, but I want to make sure that, you do take the time, because I know most folks, in any given time I do the presentation, do work with folks that it is important to know about, right? And it's important that you, as somebody who's working in the community, or even just someone who's maybe, you go to a community center and there's lots of different people that come in and out of it, right? Or you go to some other sort of group or something, right? It's important to continue this conversation, to continue learning about pronoun usage. So kind of going into switching gears and talking a little bit more about some of the data. I'm going to touch on specifically things around mental health, around different disparities and things that the LGBTQ plus community does experience. Um, I hope that as we kind of go through these, if you do have questions, again, please go ahead and put those into the chat, or you can wait until the end. We'll have an opportunity to kind of have a discussion. I want to make sure that folks do, recognize and realize like why we continue to talk about these things, and why we need to continue kind of talking about the community and how to be a better supportive person towards the LGBTQ plus community, even outside of Pride Month. So, talking about mental health, mental illness, mental, health disorders, 40%, and this is a little bit older statistic, but is something that still, is pretty steady throughout the years, and something that as we see information coming out during, COVID, right? We see a lot of research and things that are now starting to surface from the 2020 and 2021 to 2022 timeframe, right? Of especially things around mental health. But I see this 40% of lesbian, gay, and bisexual people reported having a mental illness in the last year or some sort of mental health struggle, right? This does not include transgender people. I could tell you that transgender people, it's a much higher rate, particularly because of some things that I'm going to be speaking on shortly. But this is something that is fairly common. It's not something that has been significantly reduced at all in the last several years. Given how things are moving and the direction that we're moving in this country in general, it's not a number that's going to necessarily go down either. So, kind of digging into it a little bit. 2 out of 3 people who do identify as LGBTQ plus do experience feelings of depression to some degree. That is a rate of 21% higher than those who do not identify as LGBTQ plus. Nationally, more than 1 in 5 LGBTQ plus people experience feelings of depression nearly every day. So this is, this is kind of something that helps put into perspective of, again, why we have things like, these types of trainings, why we, try to have things, positive, affirming spaces in the community, why we do Pride, right? Why we have all these different things that we try to do, because there's people that experience that, regular negative emotions, mental health struggles because of the way that, society views us, right? So this is a pretty significant, 2 out of 3 people experience this. It's a pretty significant higher rate than those who don't, identify within the community. And the fact that folks do experience these types of feelings nearly every day it's a concern, right? It's a problem. Specifically touching on youth mental health, because I think that, we often recognize that youth struggle with a multitude of different things. And whenever you're kind of layering on different, historically excluded or oppressed identities, you really have a lot more, these youth have a lot more issues than, adults that might identify within this community as well. So 42% of LGBTQ plus youth seriously considered attempting suicide in the past year. That is it's more than half of transgender non-binary youth. And when we're talking again, kind of layering on those oppressed identities of the different, communities that people might be a part of that intersect. You talk about, race and culture, um, even things like religion and disability status and all sorts of different things. Those numbers just continue to kind of go up, right? So you think about, you know, these percentages, right? So we're kind of breaking it down to, you see that the percentage of white youth is a little bit lower than we see of like indigenous, Black, multicultural races. Again, that is, think about the history of race and culture and kind of those like, again, historically excluded identities. You layer it on with LGBTQ plus identities, and it's not something that really gets any significantly better. So talking about the transgender community and mental health, this first like bullet point talking about the 48% of transgender adults that have considered suicide in the past 12 months. That is compared to 4% of the general population. That's a very significant difference. Again, this is a slightly older statistic, but it is not something that has changed. And again, as we see research coming from the last couple of years with COVID, there's some really interesting things happening. There's both, when everything shut down in 2020, transgender folks felt a little bit safer in the fact that they were able to take the time to explore themselves, express themselves without fear of judgment, without fear of, being excluded or harassed or discriminated against, right? Because everybody was in their homes. But on the same side, there was a severe lack of, community, which is something that everybody experienced, right? But it's really important to note that this is still a very significant difference that transgender adults do experience. Younger people, younger people or youth are 4 times more likely to experience depression than their non-transgender peers. So again, kind of talking about the younger generations, the younger folks. So some really, scary statistics and significant things. We have seen, news stories of youth recently or over the last couple of years that we have seen kind of the increase. We've seen more people coming out and talking about their experiences, and we've seen personal stories of friends that have lost other friends because of some of the mental health struggles that people do experience, and therefore also a lack of resources to get some of that support. So, I mean, realistically, why is this happening? Well, first of all, legislation. Something that we hear constantly, with social media, with this being a really big election year, we're seeing and hearing about more and more people that are trying to take away the rights of LGBTQ plus folks. We know that even within the last year, there are a significant amount, over 500 anti-LGBTQ plus bills that have been filed. And, a good portion of those have actually been passed in different states. North Carolina is an interesting, mix of kind of what's going on within the country. There's been plenty of anti-LGBTQ plus bills filed, anywhere from, reducing rights within schools, causing, more issues within schools, including outing, trans students, including restriction of transgender youth participating in sports. There's been a lot of healthcare bills that have been filed to restrict gender affirming care. Again, most of these do target trans folks in particular. So again, kind of going back to talking about some of those mental health statistics, it's one of the biggest reasons why people really have a hard time, because we're consistently seeing that, our rights are being taken away. People don't, want to support us. The negative always speaks a lot louder. We see that a lot more than we do the positive, right? I really encourage you, and we can make sure that this link gets into the chat as well, to check out the ACLU's website. They do consistently track legislation that affects LGBTQ rights across the country. So I encourage you to take a look at that list. It's overwhelming. It does break it down to each state, and there are certain things that you might not think affect the LGBTQ plus community. So it might not be something that very specifically targets the community. It may be something on reproductive care, right? But if you go into like reading some of those bills, you'll see where, this does affect LGBTQ plus folks. And sometimes they sneak in things that, make no sense for that bill in particular, but it is something that is interesting to see, and it does help you kind of realize and put into perspective, like, why it's important that we're continuing to advocate and do the things that we need to do to make sure that people don't lose their rights. Speaking a little bit more kind of on the legal side, the legal protection side of things, there are plenty, there's a pretty good list of states that do have the highest rates of depression amongst LGBTQ plus residents. Specifically, among the 10 highest, 7 of those don't explicitly have statewide laws that protect LGBTQ plus people. And that is particular within discrimination of employment, housing, and public accommodations. These states also don't necessarily have hate crime laws that address sexual orientation and gender identity. North Carolina is interesting. So we don't actually have a hate crime law that does explicitly address these areas and protects LGBTQ plus folks. However, the last couple of years, we've seen a lot of towns and counties actually coming out with their own non-discrimination ordinances. However, there isn't necessarily something that is statewide, right? So we know that, the Triangle area is a lot more forward-thinking and progressive. And many of the areas that are around like universities and colleges or bigger cities tend to be a little bit, have more protections and have a little bit more safety for LGBTQ plus folks. But anything outside of that there's no guarantee, right? We don't see a lot of rural areas with the non-discrimination ordinances in place. So it's something that, although there are higher amounts of people or more people, more queer and trans folks that do live in the more populated areas, like the Triangle area, there are still a number of LGBTQ plus folks that live in rural areas that don't have the same protections or support that we might in the Triangle. There's a lot of societal factors, and a lot of these things are pretty significant with youth in particular, but it is something that does affect people of all ages. So family rejection is a big one, right? So we see folks that are experiencing mental health disorders or struggles of any sort because of family rejection. There's a lack of acceptance based on gender identity and sexual orientation. And this is something that can happen at any age and does affect people's mental well-being. Being forced out. So this is, obviously affects folks that are typically younger, folks that are still living at home, which is becoming more and more these days with, how expensive it is to live on your own. But coming out to your parents, family, guardians, etc., does oftentimes result in getting forced out of the home. And so not having, a safe and affirming place to live and to be already, puts you into kind of a disadvantage of, being mentally well, right? So we're thinking about all sorts of things from just not having family supports, but also potentially not having a safe home either. Violence and discrimination. So bullying and harassment is a very common thing that we see in schools. There's been a couple of incidences over the last year of, in particular, trans and non-binary young people within schools being harassed, having violence, them being subjected to violence. There's even been a few cases of some young people losing their lives due to violence within the schools. And this is, something that we see more and more within the schools in general, but it's becoming a more unwelcoming and unsafe environment for LGBTQ plus youth. And that has a lot to do with the fact that, young people are very influenced by what's going on around them, by their families and, the different things that they're seeing in the media. And so, they're learning more about the misinformation, not necessarily like the true things around what an LGBTQ plus person is, right? Or what that means. And so we do see a lot more violence and discrimination. I think, all of us in this room probably experienced some sort of bullying when we were kids in schools. But this is, something that is consistently getting harder for our young folks. And so when we see that, we're also seeing the same things happening within communities with LGBTQ plus adults as well. And again, kind of going back to that, like more urban versus rural areas, folks in rural, counties, rural areas in particular, definitely have a harder time. We see a lot of folks that are moving to bigger cities because they don't have safe or affirming communities to live in. That could be because there's a lack of resources. It could just be because, again, there's not as much education or exposure around LGBTQ plus identities. So this is something that is pretty common. And then, of course, economic instability. This goes along with the fact that folks do lose their housing, do have, other issues within their families or communities. Poverty and lack of access to resources and services is an issue for a lot of people these days. But that's in particular for folks that have been rejected from their families. So people don't have safe and affirming families to go to lean on whenever they're going through tough times. That does increase, mental health struggles and issues that we already see are at higher rates for LGBTQ plus folks. So what needs to change? A lot of things. There's a lot of societal level, like systems level changes that need to happen that are not going to happen overnight. And we know that. But there's a lot of things that people can do just on a daily basis, anywhere from, just as simple as talking with your LGBTQ plus friend, colleague, coworker, you know, child, parent, whomever, right? And just talking to them and finding out ways that you can be more supportive. Um, and anywhere from, you know, advocating, being an advocate, talking to your legislators, writing letters, you know, going to rallies and learning more about the community, right? There's so many different things that you can do to be that more supportive person. There's a lot of ways to decrease these disparities. Increasing education on LGBTQ plus issues, especially within the mental health field. I think that this is, you know, something that folks do recognize, you know, and see. But when we don't have educated folks at every level, whether it's just for a support group, whether it's an, you know, individual therapist or counselor, or maybe like crisis services or like more clinical based services within the hospitals. I mean, there's so many different areas of that folks do need to take the time to learn and about LGBTQ plus identities and issues. Increasing the research on the community. So, you know, this is something that, as you saw, like some of the statistics and some of the data that, you know, we have, there's not a lot of super updated information, right? A lot of the information that we do have is, you know, sometimes very much estimates based on surveys or you know, different things that do get sent out, but not necessarily full on research. And of course, you know, research studies, there's a lot of different things to take into consideration, right? Folks don't want to feel like they're just lab rats or being overly researched, right? Or being asked to take every survey or be involved in every research study known. Um, but it is something that is very important because this is how we continue to learn more about different identities and different, you know, ways that folks do you know, identify with. So with more research, we do know that there's then comes more funding, that then comes potentially more services and resources for folks that might need it. So that is a big way to help kind of decrease some of those disparities that we do see. Reducing barriers to health benefits, especially gender affirming care. And gender affirming care isn't just, you know, being on hormone replacement therapy or gender affirming surgeries, right? Gender affirming care could be as simple as just having a counselor or a therapist or be a part of a support group that is affirming. You know, that facilitator, that therapist, that counselor does have the educational background and does have the information to, you know, be able to, as much as possible, fully understand that what that person is going through and how to help them through some of the issues that they're dealing with, right? It's really interesting. There's some recent kind of study and some training going on around LGBTQ affirming or affirmative CBT training. So, which is something that, you know, folks are trained in, right? There's plenty of people that are trained in CBT training, but there's, you know, not a lot of conversations around, well, what does that mean in regards to LGBTQ plus identities? And there's this kind of theory around minority stress as well. So this doesn't necessarily just have to do with an LGBTQ plus person or an identity. This could be, you know, thought about in any potential historically excluded identity, right? So we're talking about race, we're talking about disability status, we're talking about religion, we're talking about you know, age, we're talking about so many different things. So we got to really think about like how broad that gender affirming care like definition is and what that means. outside of just actual like physical medical things and surgeries. Diversify education and increase awareness on LGBTQ plus identities in schools and community agencies. So this is something that I, did speak about already a little bit. It is harder, I think, now in many states and North Carolina in particular, that it's harder to get into the school system to talk to, teachers and counselors and faculty around how they can be more supportive towards their LGBTQ plus students. Um, I know that there's different ways to kind of speak to some of the folks that are in the school system, but with the legislation and especially the Parents' Bill of Rights, um, uh, that has popped up in the last year, it's harder to get into the schools to make sure that our queer and trans students are, safe in that environment, and they're being, taken care of, and they're being affirmed. So, we got to make sure that anything outside of that, the community agencies, so the places like the after school clubs, the group settings, the environments where students and younger people in particular do attend outside of school, to make sure that they have a space that they can feel safe and comfortable. Um, so this can include a number of places. This can include churches. They're local churches. They're the like Boys and Girls Club, for instance. There could be many different places. And we also have to think about what this means for adults as well. So there's plenty of adults in the community that, again, kind of attend community events, maybe go to their local community centers, for different things, maybe, again, kind of talking about their churches or their, religious institutions. Um, or support groups, right? Like the support groups with NAMI throughout the country. So there's plenty of different things that we do need to continue kind of thinking about, and continuing to try to advocate for and push for, so that people of all ages and identities do feel welcome and comfortable, and do have a place or a person to go to, that is, affirming and supports them within their identity as who they are, and doesn't, experience any sort of violence, discrimination, harassment, etc. Right? Because the more supportive people we have in our life, the higher chance that we will, have just a more mentally healthy well-being, a more, kind of balanced life. Um, there's a lot of things to kind of take into consideration for that. But um, the more supportive people that we do have around us, the better chances we have of being, just more successful and happier. And I think everybody does recognize that. But in particular, when it comes to historically excluded identities, it is important to recognize the like specific disparities and issues that do come up. So I wanted to take plenty of time to leave plenty of room to have a discussion. So I'm going to leave my information up here for folks that may not necessarily feel comfortable speaking within the group, but please feel free to reach out to me individually. I'd be happy to share some resources. I'd be happy to share a little bit more education, or just, find a time to talk with you about maybe something that you're either dealing with in your professional or personal life. Please feel free to reach out. So